Hi, I'm Casey, and I'm going to talk to you today about what happens in your cardiovascular system, or your heart and your blood, during one of the most severe and life-threatening allergic reactions called anaphylaxis. And this affects me personally because I have an anaphylactic reaction to a protein in fire ant venom. So I'll walk you through what happens from the initial fire ant sting to what could possibly be a fatal outcome, and then through the treatment if you are stung by a fire ant and you are anaphylactic like me. Fire ant beds can be found virtually anywhere. The problem arises when the fire ant beds are disturbed. Normally, there are thousands of ants within a single nest, and if disturbed, they rush out and basically sting simultaneously. Once the stinging starts, the ants release a pheromone which brings other ants to the surface. Enough fire ant venom can cause problems even in people with normal immune systems. There are two basic components to fire ant venom. The first is piperidine, which is a chemical related to the main ingredient in black pepper. Piperidine is what causes the burning sensation that gives fire ants their name. The second component is a protein that makes up less than 1% of the venom. This protein is what actually causes the allergic reaction. Once stung by fire ants, the protein in the venom is detected and local inflammation is initiated by mast cells and basophils found in the capillary walls. During anaphylaxis, however, this reaction does not stay local. The reaction occurs systemically. The heart also has an abundance of mast cells and basophils. Once the protein reaches the heart, it interacts with immunoglobulin E, which is found on the cell surface receptors of mast cells and basophils. The presence of the protein activates the mast cells and basophils in the heart, which then release a massive amount of histamine and other mediators. Histamine may induce arrhythmia and is responsible for hypotension and tachycardia. Platelet activating factor causes an extreme reduction of coronary blood flow and reduces the heart's ability to contract. Lipid mediators influence contractile function of the heart as well and impair ventricular function. So, let's pretend this water-filled balloon represents our blood vessels. So, during an anaphylactic reaction, mast cells and basophils in your heart start releasing massive amounts of histamine. Histamine targets your blood vessels and makes them really leaky. So let's pretend that this needle is histamine, and we're going to see what histamine does to our blood vessel. Rapid drop in blood pressure. So we lose blood pressure, and without our blood pressure gradient, there's no way to get oxygenated blood systemically to the body, and without oxygen, our body won't survive. Anaphylactic shock is the final and often fatal step in anaphylaxis. This is the systemic response to the allergen circulating rapidly through the body. The release of histamine causes our blood pressure to plummet through vasodilation and fluid loss. Compounding this effect, our bronchioles constrict, which makes it difficult to breathe. Without the circulation of oxygen, our organ systems begin to fail. Loss of consciousness and death will occur soon after due to the total collapse of our circulatory system. Epinephrine acts antagonistically to histamine by acting on the beta receptors in the heart, blood vessels, and other smooth muscles found throughout the body. So during an anaphylactic reaction, our saving grace is our auto-injectable epinephrine pen. So once it's injected, you stick it in your thigh, and a needle pushes out and immediately injects epinephrine into your bloodstream. Once in your bloodstream, it causes a direct increase in ventricular contraction, so it forces blood systemically through your body, despite what histamine has caused to happen. It increases heart rate, and it causes your arterioles in your skin to contract, so the leaking and the vasodilation from histamine is negated. It also causes the smooth muscles in your bronchioles to relax, so breathing is much easier. Now let's review. After being stung by fire ants, the foreign protein acts on mast cells and basophils in your heart, causing a massive release of histamine. Histamine, in people who have anaphylactic reactions, can cause death by total cardiovascular collapse. An injection of epinephrine, however, acts antagonistically with histamine and reverses its effects. During an anaphylactic reaction, epinephrine can save your life, allowing you to go back later and kill those pesky fire ants.